So this is part 4 of lecture 4, and we're just continuing on from where we left, which was about work and interventions around work. Okay? So in terms of promoting employee mental health in the workplace, early diagnosis is really important, and then follow-up treatment. It's also been found that psychological interventions are linked to causal factors as well. So sustained contact between employers and staff, particularly when staff are absent, as well as contact between healthcare providers and employers, are really important to ensure positive mental health among employees. Another important aspect of work interventions and in promoting well-being is reducing stigma and discrimination. And you might see around Sheffield Hallam, for example, campaigns that deliver on this for staff. And, we often there's often stigma and discrimination campaigns regarding mental health for staff and for students. So anti-stigma campaigns, for example, can lead to those with depression or anxiety accessing services much more quickly, and therefore reducing the chance of long-term effects. And this can obviously mean that they get back to work quicker, which means they're more financially stable. And often when people are working, especially if they're working in a place they like to work, that often brings them greater well-being as well. But there's obviously financial outcomes as well. So the benefits of people accessing services sooner and going back to work sooner can be up to £421 per person who stay at work. So, and there's also programs where there's direct social contact between the public and those with mental illness, and these have shown to be very effective at reducing stigma and discrimination. It's really important that we are compassionate people, and that translates to people's well-being as well as to your own. Excuse me. So, Environment's also important in terms of when we're thinking about interventions for well-being. So improving housing, so environment can be found to be as a key factor in people's well-being in general, as well as obviously the other factors. But in the past, I think environment was something that was less at the forefront. But environment's particularly seen as a key factor and is concentrated more in terms of local and local government as well as national government agendas and policies. So interventions to improve housing, for example, can improve health outcomes as well as changing people's perceptions across a range of factors such as crime and safety. Neighbourhood improvements can increase mental well-being too, and particularly homeless people have 40 to 50% higher prevalence of mental health problems than the population as a whole. So tackling homelessness is extremely important and has particularly become a popular research area as well as intervention area because of that fact, and because it's becoming much more prevalent in our cities particularly. So active travel town schemes can also be really productive because they enhance the levels of non-car travel and therefore reduce the amount of traffic and speed in local areas. And this means that there's increased play and social activity and quality of life because of lower pollution and, of course, more social interaction. So those are just a few examples. We're going to again talk about environment a lot more when we go on to that topic later in the module. Okay, so the next area is social inclusion, activity and relationships. Social inclusion is the extent to which people are able to access opportunities. Taking part in social activities, having good relationships and strong social networks are all shown to be good for people's levels of well-being. Good social relationships and happiness appear to demonstrate two-way causality. People are more likely to get married, for example, and less likely to divorce if they have higher levels of life satisfaction. People with higher levels of well-being have better relationships for a number of reasons also. For example, positive moods can make people feel more sociable, and there is more enjoyment from other people's company. Social networks can be important tools in building people's resilience as well. At a community level, those areas which have high levels of resilience tend to have a strong attachment to local areas, and this is associated with good social networks. Older people have been found to have higher levels of resilience when provided with a high level of social support, both before and during adverse circumstances. And for young people, friends, support networks, social roles which are valued, and positive perspective on local area have been found to help reduce chances of emotional and behavioural problems, as well as the severity of these problems. Additionally, it has been found that policies which target and reduce inequality and promote anti-discrimination legislation promote social inclusion. So policies which promote social interactions have been found to improve well-being, and social prescriptions link patients in primary care with non-medical support in the community, and social prescriptions have become increasingly popular in the last 10 years. They have been found to improve mental health outcomes, improve community well-being, and lower social exclusion. Interventions including exercise on prescription, or prescription for learning and arts on prescription, have been used to increase vulnerable people's self-esteem, self-efficacy, mood, and social contact. Time banking has also been found to be effective and increase levels of engagement quickly. Time banking can also cause negative social problems to fall and break cycles of dependency, such as alcohol and drugs, and inactivity. Community-based art projects also have been found to improve people's confidence, empower communities, give a sense of self-determination, as well as enhancing people's perceptions of their local area and creating social cohesion. Arts projects with focus on cultural well-being, self-expression, and creativity have helped improve neighbourhoods, and increasing social contact can also increase the levels of well-being for older people. Research suggests that interventions should be targeted at specific groups of older people, and the activities should also allow participating people to help shape the activities. So this is where ownership is really important. So whenever you're thinking about interventions, ownership is a really important aspect if you're going to achieve or foster empowerment. And empowerment can have really good positive consequences such as self-esteem, higher confidence, and by empowering people, they're more able to maintain a positive well-being behaviours. So group activities such as self-help groups and day centre lunch clubs, for example, are more effective than supporting individuals through individual-based interventions such as telephone services or individual therapy. Occupational therapists leading group-based health promotion have also been found to improve social functioning. And befriending has been found to have benefits in terms of tackling depression and to be quite cost effective as well, which is obviously appealing to local councils. Community Navigators is another example of a program which have also been found to be effective in helping older people in terms of tackling isolation and improving well-being. And psychosocial interventions can be effective in promoting well-being for the general population, as well as quality. However, the quality of research in relation to that example of community navigators is a bit limited, but it is just one example. And in this lecture, we give examples, but there's lots more out there as well. So it's really important you do your own reading and find out more. Okay, so yeah, so anyway, so we'll finish this slide off with saying psychosocial interventions lasting over 3 months have been found to be more effective than ones that last less than 3 months. So again, when you're thinking about your interventions in your assessment, you need to think about duration and how important that is. For some programs it's less important, but that's a really good example here, this last statement, that, you know, quite clearly research has found that a program lasting over 3 months was more effective than less. And that's super important, because you can put a lot of effort and money into something, but if you don't do it for a long enough time, or don't create the right environment to create relationships, positive relationships with people, then that can undermine the intervention itself. Okay, so we'll stop just there, and that's 10 minutes or 11 minutes, and because the next section of the lecture is talking about prevention approaches. So far, in summary, for the first half of the lecture, or 3/4 of it, we've been talking about interventions, which is probably the most popular approach for well-being. And we've covered mainly, we've focused mainly on early intervention, but we've also gone through health, environment, learning, social inclusion, and work-based interventions as well. So it really gives you a good overview. So I hope you've enjoyed that, and the next part of the lecture will be on prevention approaches. See you soon!